Glipizide is a medication that is used along with a healthy diet and exercise to manage high blood sugar in individuals with type 2 diabetes. It can also be used in combination with other diabetes medications. By controlling high blood sugar, glipizide helps to reduce the risk of kidney damage, blindness, nerve issues, amputations, and sexual function problems. Properly managing diabetes can also lower the risk of heart attacks and strokes. Glipizide is classified as a sulfonylurea drug and works by stimulating the release of the body's natural insulin. It is usually taken once a day, 30 minutes before a meal. The dosage will depend on your medical condition and response to treatment, so it's important to follow your doctor's instructions. It's important to take glipizide at the same time each day to maintain a consistent level in your body and to reduce the risk of side effects. You should take glipizide by mouth, about 30 minutes before breakfast or your first meal of the day, as prescribed by your doctor. Usually, it is taken once daily, but some patients may need to take it twice a day, especially if they are on higher doses. The dosage will depend on your medical condition and how you respond to the treatment. To reduce the risk of side effects, your doctor may start you on a low dose and gradually increase it. It's very important to follow your doctor's instructions carefully. If you are already taking another diabetes drug, your doctor will give you specific directions on how to switch to glipizide. It's important to note that colesevelam can decrease the absorption of glipizide, so if you are taking colesevelam, make sure to take glipizide at least 4 hours before or after taking colesevelam. In order to get the most benefit from glipizide, it's important to take it regularly at the same time each day. If you have any concerns or if your condition does not improve, be sure to communicate with your doctor. Some common side effects of glipizide may include nausea, vomiting, loss of appetite, diarrhea, constipation, upset stomach, headache, and weight gain. However, many people using this medication do not experience serious side effects. It's important to be aware that this medication can cause low blood sugar, which may result in symptoms such as sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. To prevent low blood sugar, it's recommended to eat meals on a regular schedule and not to skip meals. Additionally, if you experience symptoms of high blood sugar, such as increased thirst or urination, it's important to notify your doctor right away. In the case of a serious allergic reaction, including rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist. Before taking glipizide, make sure to tell your doctor or pharmacist about any allergies you have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have liver disease, kidney disease, thyroid disease, hormonal conditions, electrolyte imbalance, or if you are pregnant or breastfeeding. When taking glipizide, be cautious about the potential side effects such as blurred vision, dizziness, or drowsiness due to low or high blood sugar. Avoid driving or using machinery until you are sure you can do so safely. Additionally, limit your alcohol intake as it can increase the risk of low blood sugar and may interact with glipizide, causing a serious reaction. If your body is stressed due to fever, infection, injury, or surgery, it may be harder to control your blood sugar. Make sure to consult your doctor as this may require a change in your treatment plan or medications. It's important to be mindful of sun exposure while taking glipizide, as it may make you more sensitive to the sun. Use sunscreen, wear protective clothing, and limit time spent in the sun to avoid sunburn or skin irritation. For older adults, it's important to be aware that they may be more sensitive to the side effects of this drug, especially low blood sugar. During pregnancy, the use of glipizide should be carefully considered and discussed with your doctor. If used during pregnancy, it may need to be switched to insulin at least 2 weeks before the expected delivery date due to the risk of causing low blood sugar in the newborn. If you are breastfeeding, consult your doctor before taking glipizide, as it is unknown if this medication passes into breast milk. Similar drugs have been known to pass into breast milk, so it's important to discuss the potential risks and benefits with your doctor. It's important to be aware of any potential interactions between glipizide and other medications you may be taking. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Before starting, stopping, or changing any medication, talk to your healthcare providers about how it may affect your blood sugar. Regularly monitor your blood sugar levels and report any symptoms of high or low blood sugar to your doctor. It's also important to note that certain medications, such as beta blockers, may affect how you feel the symptoms of low blood sugar. Additionally, be cautious with over-the-counter medications, as they may contain ingredients that could impact your blood sugar levels. Always consult with your pharmacist before using these products. If you or someone you know has taken too much glipizide and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. Call 911 for emergency assistance, or contact a poison control center as soon as possible. In the U.S., you can call 1-800-222-1222 for your local poison control center, while residents of Canada can reach out to their provincial poison control center. Symptoms of an overdose may include shakiness, rapid heartbeat, sweating, and loss of consciousness. Make sure not to share this medication with others. It's important to attend a diabetes education program to learn more about managing your diabetes with medications, diet, exercise, and regular medical exams. Be sure to learn the symptoms of high and low blood sugar, and how to treat low blood sugar. It's also important to check your blood sugar regularly as directed. You may need to undergo lab and/or medical tests, such as liver/kidney function, fasting blood glucose, hemoglobin A1c, and complete blood counts while taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. In terms of dosage, glipizide is usually taken once a day with breakfast or the first meal of the day. It's important to follow your doctor's instructions for the best time to take this medication. As for the benefits, glipizide helps to lower blood sugar levels in people with type 2 diabetes. It works by stimulating the pancreas to produce more insulin and helps the body use insulin more efficiently. If you forget to take a dose of glipizide, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. Make sure to store glipizide at room temperature, away from light and moisture. It's important to keep it in a safe place where children and pets can't get to it. When you no longer need it or it's expired, make sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.